السلام عليكم طلاب. محاضرتنا اليوم حول الدايجستيف سيستم ديزيز أي أمراض الجهاز الهضمي. راح نتطرق للموست كومن ديزيز اوف digestive system. أول نبدي بالهرنيا. Hernia occur when an organ or other piece of tissue protrudes through a weakening in one of the muscle wall that enclose the abdominal cavity. This picture show the hernia. هاي الصورة تبين لنا انه الخلل وين يصير، هو يصير weakness بالabdominal wall، وبالتالي جزء من الانتستين راح يظهر، اي راح يصير tearing بالabdominal wall، وبالتالي راح يظهر جزء من الانتستين. The most common abdominal hernia are in the ground inguinal hernia, in the diaphragm called hiatal hernia, and the belly button called umbilicus or umbilical hernia according to area. In the umbilical called umbilical hernia قد تحدث في epigastric area or inguinal hernia or femoral hernia. Hernia may be present at birth, called congenital, caused by improper closure of the tract that develops as a testis descend into the scrotum during fetal development, or they might develop at any time thereafter. Acquired مكتسبة defect that result from weakness of the posterior inguinal wall. أما تكون congenital ولادية، أو قد تكون مكتسبة أثناء or any time، أي develop any time. Common type of hernia. Inguinal hernia. Inguinal hernia are the most common type of hernia. They make up about 70% of all hernia. This hernia occurs when the intestine push through a weak spot or tear in the lower abdominal wall, often in the inguinal canal. This picture show the inguinal hernia، أي إنه راح يصير tearing، راح يظهر أو يخرج من inguinal canal. The inguinal canal is found in your ground. In men, it is the area where the spermatic cord passes from the abdomen to the scrotum. This cord holds up the testicles. In women, the inguinal canal contains ligament that help hold the uterus in the place. وبالتالي نرى انه الرجال اكثر اصابة من النساء، وذلك لان النساء تحتوي او يكون سبورت للانجوينال كيرل عن طريق ليجمنت. هذا الليجمنت راح يسوي سبورت للاريا، وبالتالي نرى ان حدوثها بالرجال اكثر ما تحدث بالنساء. This type of hernia is more common in men كما ذكرنا سابقا قبل قليل the men than women، اكثر حدوثا او اكثر شيوعا بالرجال من النساء. This is because a man's testicle descend through the inguinal canal shortly after birth, and the canal is supposed to close almost completely behind them. Sometimes the canal does not close properly and leaves a weakened area prone to hernia. Hiatal hernia. Hiatal hernia occur when part of your stomach protrudes up through the diaphragm into your chest cavity. أي إنه جزء من الستومك راح يصعد أعلى أو فوق الحجاب الحاجز، أي يدخل بالchest cavity, or a defect in the diaphragm that allow a portion of stomach، أي إنه جزء من الستومك to pass through the diaphragmatic opening، أي يدخل عن طريق الفتحة حجاب الحاجز into thorax إلى chest cavity. This type of hernia the most common in people over 50 years old. If a child has the condition, It is typically caused by congenital birth defect. Hiatal hernia. Almost airway caused gastroesophageal reflux GERD هو most common disorder بالdigestive system, which is when the stomach content leg backward into the esophagus causing burning sensation. أي إنه جزء من الكونتين من محتوى المعدة راح يصعد إلى الاسوفيجاس إلى المريء، وبالتالي اختلاف الحامضية والقاعدية للكونتين راح يسبب لنا burning sensation، يشعر بالحرقة، وقد يكون عنده هذا الرفلكس. Umbilical hernia. Umbilical hernia can occur in children and babies under 6 months old. This happens when their intestine bulge through their abdominal wall near the belly button، أي إنه يحدث انتفاخ قريب عن السرة. You might notice a bulging or a bulge in or near your child belly button, especially when they are crying، وخاصة يظهر هذا الانتفاخ عندما يبدأ الطفل بالبكاء. Incisional hernia، إن ذاك النوع اللي ذكرناه umbilical hernia most common بالchildren، وخاصة بالأعمار هو اللي under 6 months old. Incisional hernia. Incisional hernia can occur after you have had abdominal surgery. Your intestine might push through the incision scar or surrounded weakened tissue. إنه هذا الهرنيا من اسمه incisional hernia اللي قد يكون مسوي surgical، وبعد surgical قد يكون هذا weakness بالوول abdominal wall، وبالتالي راح يسبب لنا بوش أي اندفاع جزء من الانتستين، وبالتالي راح يسبب لنا نوع من أنواع الهرنيا اللي يسمى incisional hernia. Causes of hernia: congenital defect, being pregnant which put pressure on your abdomen، أي أن pregnant الحامل يصبح أو يظهر لديها ضغط على الابdominal wall. lifting heavy weight اللي يحملون أشياء ثقيلة. fluid in the abdomen or ascites. fluid in the abdomen أي أنه يحتوي البطن على سوائل، أو ascites هو accumulation of fluid in the abdominal cavity. suddenly gain weight اللي يصير عندهم زيادة بالوزن. surgery in the area اللي ذكرناه واحدة من أنواعها هو incisional hernia damage from injury or surgery. persistent coughing أي chronic coughing for long time. peritoneal dialysis used to treat kidney failure and tumor or masses in the abdomen. Risk factor for a hernia: increased intra-abdominal pressure may lead to weakened or a portion of the abdominal wall, either acutely or gradually over time. Some risk factors include the following: a personal or family history of hernia, chronic cough, recurrent vomiting, obesity, ascites, abnormal collection of fluid in the abdominal cavity, peritoneal dialysis, abdominal masses, pregnancy, abdominal surgery, a risk for incisional hernia, repeating moving or lifting heavy object. هاي بالنسبة للريسك فاكتور. Sign and symptom of hernia: you are more likely to feel your hernia through touch when you are standing up, bending down, or coughing. If your baby has a hernia, you might only be able to feel the bulging when they're crying. A bulge is typically the only symptom of the umbilical hernia. قلنا قد يكون بالكافينج إذا أردنا بالأدلت patient بالكافينج بالوقوف لفترات طويلة قد نميز أو نعرف الهرنيا. أما بالنسبة للبيبي أثناء الكراينج البكاء قد تظهر هذا الانتفاخ. Most people can feel a bulge where an inguinal hernia develop in the groin. There might be a burning or sharp pain sensation in the area because of inflammation of the inguinal nerve. If a hernia occurs because of an event like lifting a heavy weight, a sharp or tearing pain might be felt. There can be significant pain and nausea and vomiting, signals the possible development of bowel obstruction. Fever might be associated with strangulated dead bowel. Other common symptoms of the inguinal hernia include pain or discomfort in affected area, usually the lower abdomen, especially when bending over, coughing or lifting, and burning or itching sensation at the site of bulge. Diagnosis of hernia. Inguinal or incisional hernia are usually diagnosed through a physical examination. Your doctor might feel for a bulge in your abdominal ground that gets larger when you stand, cough or strain. If you have a hiatal hernia, your doctor might diagnose it with a barium X-ray or endoscopy. A barium X-ray is a series of X-ray pictures of your digestive tract. The pictures are recorded after you have finished drinking a liquid solution containing barium, which show up well on the X-ray image. Endoscope involves threading a small camera attached to tube down your throat and into your esophagus and stomach. This test both allow your doctor to see the internal location of your stomach. If your child has an umbilical hernia, your doctor might perform ultrasound, creating an image or structure inside the baby or the body. انه التشايلد نريد نعرف اذا عنده كانت هرنيا او اللي موست كمان هي امبلايكال هرنيا عن طريق نقوم باجراء او بيفورم انجاز او اجراء التراساوند السونار حتى نعرف المنطقة اللي صاير بيها تيرنج. Treatment option for a hernia, whether or not you need treatment depend on the size of your hernia and severity of your symptom. تعتمد على الحجم مالته بالاضافة الى شدة العلامات والأعراض مال hernia. Your doctor might simply monitor your hernia for possible complication. Treatment option for a hernia include lifestyle changes, medication, or surgery. Lifestyle change. Dietary change can often treat the symptom of hiatal hernia, but won't make the hernia go away. Avoid large or heavy meal. ابتعاد عن الوجبات اللي تكون ذات أحجام كبيرة. Do not lie down or bend over after meal and keep your body weight in a healthy range. حافظ على الوزن الطبيعي. Certain exercise might help strengthen the muscle around the hernia site, which might reduce some symptoms. However, exercise done improperly can increase pressure at that area and might actually cause the hernia to bulge more. قدر الإمكان نسوي بعض التمارين اللي هي تحافظ لنا على الوزن الطبيعي، بالإضافة ما نسوي التمارين اللي تزيد البرجر على الأبدومن اللي راح تسبب لنا انكريز أو راح تسبب لنا سوء حالته، وبالتالي راح تسبب لنا أكثر مكان تعرض للهرنيا. If this change do not eliminate your discomfort, you might need surgery to correct the hernia. You can also improve symptoms by avoiding food that cause acid reflux or heartburn, such as spicy food. Additionally, you can avoid acid reflux by losing weight and giving up cigarette. Medication. If you have a hiatal hernia, over-the-counter and prescription medication that reduce stomach acid can relieve your discomfort and improve symptoms. This include anti-acid, H2 receptor blockers and proton pump inhibitor اللي كلهن يقلل الأسيد. anti-acid. Surgery. If your hernia is growing larger or causing pain, your doctor might decide it's best to operate your doctor by repair your hernia by sewing the hole in the abdominal wall closed during surgery. This is most commonly done by patching the hole with surgical mesh. يكون وضع شبكة حتى تصير support للاريا. Hernia can be repaired with either open or laparoscopic surgery. Laparoscopic surgery uses an a tiny camera and miniaturized surgical equipment to repair the hernia using only a few small incisions. Laparoscopic surgery is less damaging to the surrounding tissue. Open surgery required a longer recovery process. You might be unable to move around normally for up to 6 weeks. Laparoscopy surgery has a much shorter recovery time, but the risk of your hernia reoccurring is higher. حقيقة ان الاوبن سيرجري تحتاج الى recovery process، الى عملية وقاية تحت قدر الامكان انه 6 اسابيع، بينما باللابروسكوبي لا تحتاج الى هذه الفترة بالريكفري بروسيس، ولكن ريسك بالنسبة لللابروسكوبي تكون risk of your hernia reoccurring is higher، قد ترجع تحدث الهرنية إذا كانت لابروسكوبي، بينما بالأوبر سيرجري صحيح تحتاج إلى فترة recovery process عالية أو طويلة مو مثل اللي موجودة باللابروسكوبي. In addition, not all hernia are suitable for laparoscopy repair. This include hernia where a portion of your intestine has moved down into the scrotum. Complication of hernia. If lifting untreated, your hernia may grow and is become more painful. May grow and become more painful. A portion of your intestine could become trapped in the abdominal wall. This can obstruct your bowel and cause severe pain, nausea or constipation. An untreated hernia can also put too much pressure on nearby tissues. This can cause swelling and pain in the surrounded area. If the trapped section of your intestine does not get enough blood flow, strangulation occurs. This can cause the intestinal tissue to become infected or die. A strangulated hernia is life-threatening and requires immediately medical care. If a hiatal hernia is large, part of stomach and esophagus can displace into the chest. Depending on the situation and anatomy, the stomach can twist, valvulus, potential leading to strangulation. This is a surgical emergency. Prevention of hernia. While congenital hernia cannot be prevented، الولادة ما نقدر نمنعها. The risk of developing a hernia that occur as life goes on can be minimized. The goal is to avoid increase in pressure within the abdominal that could stress the weak area in the abdominal wall. Maintain healthy weight. قدر الإمكان أن يحافظ على الوزن الطبيعي. Eat a healthy diet and exercise routinely to minimize the risk of constipation and straining to have a bowel movement. أي eat healthy بصورة طبيعية، أي الحمية الطبيعية and exercise حتى نحافظ على الوزن الطبيعي. Also use proper lifting technique, especially when trying to lift heavy object. This is important to remember at work, home and in sport. بالإضافة نستخدم الطريقة التكنيك الصحيح في حمل الأشياء الثقيلة. كذلك يجب من المهم أن تذكر at work والhome and sport. Also stop smoking، أي توقف التدخين. to decrease recurrent coughing، لأن السموكينج راح يحفز لنا أو راح يسبب لنا coughing، وبالتالي أثناء الكوفينج أو الكرونيك كوفينج راح يسبب لنا بريشر على الأبدومن. هاي بالنسبة للبريفنشن of hernia. Thank you for listening.